All right, that will be interesting. Looking forward to that, Scott. It is time now for Medical Rounds. Today we're talking about our bones and how to know if you should see a doctor for pain or an injury. Dr. Daniel Witmer is an orthopedic surgeon at the Bone and Joint Institute, and he's here to answer some important questions. Thank you for being with us, Doctor.
Thanks for having me.
So lots of folks have been maybe putting off doctor visits and maybe living with their pain during COVID. Why is that a big concern?
We've seen it as a concern because we see patients come in who have become more progressively disabled because they're putting off orthopedic issues. And what we're seeing is that their muscles and their ability to recover after getting these issues finally fixed is a little bit harder for them, and it takes a little bit longer. And that's because they haven't been as active. They're basically staying home and dealing with their pain that way. So we found it to be a bit of a challenge during COVID, taking care of people who have put things off for a number of months.
All right, and what are some common conditions or injuries that should be addressed sooner rather than later?
Well, certainly the number one thing is any kind of acute injury or something that happens after a trauma or a slip and fall. If you slip and fall and you find that you have a lot of knee or hip pain or other joint pain, you need to come in and be seen as soon as possible. Other things that I think are important to know is that if you have pain in a joint that's limiting you from walking, and this is going on for more than 4 to 6 weeks, this is something that really should be seen, and you really shouldn't put it off that much longer.
Now, some people may have orthopedic injuries that they hope will resolve on their own. How long is too long?
So generally, there are some flares of hip and knee pain that can happen, especially in folks that have arthritis. If that gets better with taking Tylenol, Advil, other anti-inflammatory medications, let's say in 3 to 4 weeks, then that's reasonable. If it goes on for more than a month, though, and it's not getting better, you really should come in and be seen.
And doctor, quickly, if people are feeling reluctant to go to the doctor during this pandemic, what would you tell them?
I would tell you that I think that's a very reasonable thing to be concerned about during the pandemic. That being said, the doctor's office is a very safe place to go. In my opinion, it's safer than many other public places to go. All of our staff are tested and monitored. We wear a mask consistently 24/7 when we're seeing patients, and patients are also wearing a mask. We've been lucky here at Orthopedic Associates that we have yet to have a case of a patient catching COVID, likewise in the hospital, at Hartford Hospital. We've been very lucky, and those numbers have been exceedingly low.
Lucky indeed, Doctor.
It is a very safe thing to do.
Thank you so much. I'm sorry that we are out of time, but I want to let folks know that the conversation continues on the Hartford Healthcare Facebook page at 12:30. Dr. Witmer is going to be available to answer all of your questions, so join him there. Thanks, Doctor.